My name is Dr. Matute. You are welcome to a brief summary anatomy of the human skin. The human skin has a couple of functions: protection, thermoregulation, metabolism, blood reservoir, excretion, and cutaneous sensation. The human skin is divided into three main layers. From the top to the bottom, this is the epidermis. This pinkish portion is the dermis. The yellowish portion is the hypodermis. So hypodermis, dermis, epidermis. The hypodermis is made up of adipose connective tissue. The dermis is made up of dense connective tissue. The epidermis is made up of mostly dead cells. Now, if we take a closer look at the epidermis is subdivided into 5 sublayers. The epidermis is subdivided into 5 sublayers. This is one of them right here. This another one, this another one, this another one, this another one. So you have this one, this one, this one, this one, this one. Now, what are their names? From the outside to the inside, this is the stratum corneum. The second one is the stratum lucidum. The third one is the stratum granulosum. Number 4 is the stratum spinosum. And number 5 is the stratum basale. So this will be stratum basale, stratum spinosum, stratum granulosum, stratum lucidum, and stratum corneum, that is the stratified layer or conified layer. Now, all of the sub layers of the epidermis are dead, except for the stratum basale, where we have some mitotic cell division activities. Now, when we come to the dermis, see everything pinkish here. This is the dermis. So everything pinkish here. From here to here, everything pinkish here. This is the dermis. This dermis too is subdivided into 2 sublayers. So this is the first sublayer of the dermis, and then this is the second sublayer of the dermis. This first sublayer of the dermis is called the papillary layer. Papillary layer. The second portion is called the reticular layer. Reticular layer, papillary layer. Now here you can see red vessels here. These red vessels are arteries. The red vessels are arteries. The blue vessels are veins. So veins and arteries, they transport blood. Everything that you see yellowish here, though they look like blood vessels, they are not blood vessels. They are sensory nerve fibers. Sensory nerve fibers. They belong to the nervous system. Over here, this will be an example of naked free ending. Naked free ending. This one here, just next to the stratum basale, it's Messner corpuscles or a tactile corpuscles. And then this one here, which is this will be called a laminated or Pacinian corpuscles. If we come over here, this model, we will see this will be a tactile corpuscles right over here. This will be a laminated one. This will be a laminated corpuscles. Here, this is the hair follicle. Hair follicle. This is the hair shaft. So hair follicle, hair shaft, hair. Hair follicle, hair shaft, hair. This is the erector pili muscle. Erector pili muscle. It is attached to the hair follicle. This is a sebaceous gland. Sebaceous gland. This is a dissection of the sebaceous gland. You can see that they are attached to the hair follicle as well. This is a sweat gland. Sweat gland. This is a sweat duct. This is sweat pore. Sweat gland, sweat duct, sweat pore. Now here on the epidermis, these are epidermal ridges. Epidermal ridges. These sharp points are called epidermal ridges. Then the troughs between the sharp points, they are called papillary layers, or they're called dermal papillae. Dermal papillae. So these are called the dermal papillae, and then the sharp points, they're called the epidermal ridges. Now, if there are two main homeostatic imbalances of skin. Two main homeostatic imbalances of skin. We have burns and we have cancer. Sometimes these two homeostatic imbalances, they are recognized or described based on the location in the three main skin layers. So let's start with the burns. We have first degree burns, second degree burns, and third degree burns. A first degree burn, which is illustrated here, is located mostly in the epidermis only. A second degree burn extends from the epidermis to the dermis. A third degree burn covers all three layers of the skin. So this will be a first degree burn, second degree burn, and a third degree burn. Now for the skin cancers, it follows the same reasoning. The squamous cell carcinoma is restricted mostly just around the epidermis. Squamous cell carcinoma, and for the most part, it is found around the upper layers of the epidermis. Then we have the basal cell carcinoma. Basal cell carcinoma. It starts from the base of the epidermis, stratum basale, and then it spreads down to the epidermis. So it covers the epidermis. It spreads down to the dermis, rather. So it covers the epidermis and the dermis. Then we have melanoma. Melanoma starts from the epidermis, of course, and then it cuts across all three layers of the skin. So this will be melanoma, this will be basal cell carcinoma, and this will be squamous cell carcinoma. Right, so we are done with a brief introduction of the skin anatomy.